Hello everyone, greetings everybody. I'm Priyanjali from Bladder Wellness team. I'm sure all of you must be keeping good health. Today we are going to discuss a very important topic. Renal calculi or kidney stones are hard pebble-like pieces of material that form in one or both your kidneys when high levels of certain minerals are in your urine. Kidney stones vary in size and shape. They may be small as a grain of sand or large as a pea. Rarely, some kidney stones are as big as golf balls. If you have symptoms of kidney stones, including severe pain or bleeding, seek care right away. A doctor, such as a urologist, can treat any pain and prevent further problems such as urinary tract infection, commonly known as UTI. To throw more light on the subject and guide us on what's right for diagnosis and treatment of renal calculi, today we have with us renowned urologist Dr. Sankalp Joshi, MBBS, MS Surgery, DNB Urology. He has rich experience and hands-on expertise in urology, BPH, and stone management. He's currently practicing at Total Urology Solutions, Indore. Dr. Sankalp Joshi has rich experience in the field of urology and carries out the renal calculi diagnosis and treatments with utmost precision and efficiency, ensuring that the patient health is in safe hands. First of all, welcome, doctor, to today's platform. Our first question, doctor, would be what are kidney stones?
Uh, Ma'am, kidney has a natural function of cleaning our blood. So the main kidney function is filtration of the blood. So you can say the bad blood comes to the kidney, and the kidney works like a filter, and it filters the bad parts of our blood, and it returns the good blood back to the body.
Right,
Those things which are filtered, they in form of various crystals and various byproducts, they are usually expelled out of the body in urine actually. So
right,
when the concentration or when the titration, a particular concentration of these concentrates exceeds some baseline, it is more than a limit, then they tend to crystallize in the system. So over the period, if the sedimentation process exceeds what the dilution process is there, so you tend to get crystals formed in the our kidneys and in the genitourinary systems. So basically, kidney stones are uh, basically the byproducts of our body only, but because they are not very nicely filtered out, so they tend to aggregate, and over the period they tend to form layer by layer, and they tend to increase in size if not taken
right,
care of at a right moment of time.
right.
Yeah.
So, doctor, we know that when it comes to any sort of disease, the problem occurs when we are not able to identify the disease at the right time. So, how does the initial stage look like when it's an occurrence of kidney stone? What are the symptoms of kidney stones?
If today the lifestyle has a lot of impact on the day to day or health related issues of our most of the community. So people who are not taking enough liquids, like they are minimum 2.53 liters, they are not able to take fluids, or their day to day life is like they are in working in very hot humid environments where there is body loss is excessive, and they are not able to make that loss. So few of these subsets of people, they are prone to have a concentrated urine. Okay. So what when over the period a patient or some any normal is seeing a concentrated urine, like it is not clear or it is not that straw colored which is speaking that it is normal, and it is a darkish or it is concentrated urine, then those are at risk individuals. Or something at risk we are talking about when there is a family history, something that is known to a person, that his father or his mother is already having a high risk of stone formation in the family, stones is running, and he's not aware and he's not regularly meeting up, checking up with for himself, then he would present at a later stage when the optimum time duration would be lost, and then to manage a bigger stone is difficult rather than managing it at a initial step. So that way we can approach a healthy community. Once a diagnosis is made at the GP level, or some already know that the stone is there, then the scenario changes. Okay, but to have at the screening part, what I am trying to say, once you want to identify ki kahin main normal, I am a normal individual, what are my chances? So if you are not drinking enough water in 24 hours, and you tend to be sterners in your activities, and you have a family history, then you should definitely screen yourself and get basic tests done, so that stones can be identified at an early stage. That's what I'm
Right.
trying to say. Yeah.
Right. So, doctor, you have already mentioned about the proper intake of fluid. What can be the other causes of the occurrence of kidney stones? Any other causes?
Yeah, diabetes is a very common actually factor. In diabetics, the body tends to have more of kidney stone problem. The thing is, diabetics are also more prone to infections, urinary infections. So
Right.
urinary infections are basically a kind of a pathophysiologic element of initiating a stone nidus formation. So these things, and sometimes there are parathyroid hormone excess is there. Sometimes the uh, dietary habits are such that the person is having a lot of intake of red meat, or what is not supposed to be taken in that quantities, and he's not drinking enough water. So those persons tend to have a higher chances of stone formations,
Right. Uh,
or some
Now that we
congenital.
know,
Yes, congenital anomalies already there, like stasis is there, or some patient also already know that there are residual urine in the bladder, which is not getting properly treated. Then over the period, these patients are at high risk of developing stones in that residual urine, be it
right,
a pelvic ureteric junction obstruction in early age group, or there is a BPH, bladder outlet obstruction, prostate problem in an old age group. So according to the age wise, patients can have different presentation of stones.
right. So there are a lot of causes apart from having water. Now, doctor, if we connect water with all the other causes, can water be the only solution to all of them?
Every aspect, or you say every treatment modality, or everything revolve around water.
Right,
So thing is ki uh, water intake is the basic of our advice for the patients. So there are many other factors that I already said, that he is poorly diabetic and still he is taking a lot of fluid, but he is not maintaining his sugars, what has to be maintained. Then there is a chances कि he would develop a stone disease, या कुछ कंजेनाइटली है, जैसे उसको यूरिक एसिड मेटाबॉलिज्म, सम कंजेनाइटल प्रॉब्लम इज देयर, or he is already on this ART antiretroviral therapy. So like indinavir stones are there, which are in those taking indinavir tablets for ART. So there are many other causes also which can be ascribed to a formation of stones, but the gist, or the the soul of stone management is the water only. So
right,
it has
right,
to be taken proportionately over the period, round the clock, if a patient is high risk. So you
right,
can't
right.
avoid water out of the management of stone disease management.
Exactly. So today we are particularly talking about stone management, or the causes or the symptoms, or how we can deal about the diagnosis and everything. But if we have water in the topic, I believe, doctor, most of the diseases, our internal diseases, can be cured by water only. Just
Yes,
proper
yes, yes.
intake of
Yes,
water.
proper intake of round the clock water. Yes, yes.
Right. Right. Now, coming back to the same point, doctor, we'll move on to the next question. The next question for you would be, do kidney stones occur in one kidney, or it can happen in both the kidneys?
Can you repeat that? Can kidney stones be?
Absolutely, absolutely. Doctor, the question is, do kidney stones form in one kidney or both the kidneys?
Yes, there are tendency is actually, if the patient is a hypercalciuric, or he is hyperoxaluric, then both the kidneys would be equally secreting those salts in the urine, and there would be equal chance of him having stones in both the kidneys. But if we compare that patient is having some kind of a mechanical obstruction in one kidney, like he is having pelvic ureteric junction obstruction in one side, so there would be tendency that because the urine is more stasis is there in that system, so usko that on that particular side he would have a higher chances of stone. Or suppose some infection has only kept its nidus in one system, then that particular system is at a higher risk of developing a stone over the period. So stones usually, if there is a metabolic reason like a diabetic patient, so the chances of stone on having on both the system is equal. But if there is, like, he is parathyroid, he is having a hormonal imbalance of parathyroid, then the chances would be that he would have bilateral renal stone disease. So that
Right.
way it goes. Yeah.
So, do all stones require surgery?
No, no, nothing. Stones only those who are those who are formed in the kidneys and they have started migrating down the ureter and they are causing